to share the class with you. And if I ask a question, I will be glad if you answer, or you can type in the chat box, whatever you prefer. Okay, let's. As I will talk about the definition of vomiting. As you know, vomit is an unpleasant event for children. It starts with nausea, which is the sensation of vomiting, and after that, autonomic signs and symptoms occur. For example, increasing in heart rate or changing in, pupil size occur, and after that, retching. We have retching, which is the contraction of the abdominal muscles. And at the end, forceful expulsion occurs, and the content of the stomach are expelled out. The second definition that patient food from the esophagus or stomach without nausea or forceful contractions of the abdominal muscles. As you can see in this picture, your child is happy and is laughing. It's because that you don't have any contractions in your abdominal muscles and just regurgitations of the food from your. So it isn't unpleasant of vomiting, which is located in the medulla in brainstem. As you can see in this picture, we have a chemoreceptor trigger zone, which is stimulated by many receptors like emetic drugs receptors, serotonin, vagus nerve, dopamine. If you stimulate the chemoreceptor trigger zone, then the vomiting center will be stimulated. And beside the chemoreceptor trigger zone, vestibular nucleus chemoreceptors, baroreceptors, cerebral cortex, and pain receptors can also stimulate the vomiting center. And at the end, the act of nausea and vomiting occurs. Okay, the etiology. Can anyone tell me some of the most you can raise your hand and open your microphone or tell me in the chat box. Ranga, can you tell me?
Are you hearing me, Professor?
Hello, how are you, Ranga?
Hey, I'm fine. Some of the etiologies of vomiting, I think it includes things like gastroenteritis, things like a toxin, or things like meningitis, or food poisoning, blah, 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 blah.
Very good, thank you. Now you can see a list of etiologies. At first is extra gastrointestinal infection. The extra GI infections are the most common cause of vomiting. You may think that viral gastroenteritis or bacterial gastroenteritis are more common, but no, actually the extra GI infections are more common. I can name sinusitis, otitis media, and meningitis as examples. I'm sure that you have seen children with chief complaint of otitis media and the diagnosis of otitis media and chief complaint of vomiting. I'm gonna tell the etiologies. So if you see a child with vomiting, you should have all of this in your mind. And with examination and taking history, you can rule out the others and find the exact diagnosis. Another etiology is gastrointestine and liver infection. Gastrointestine infection can be viral. For example, the most common causes are rotavirus or, for example, coronavirus, norovirus, and liver infection. I can name the hepatitis A virus, GI obstruction. For example, if you have malrotation, then your gastrointestinal system will be obstructed and vomiting occurs as a consequence. Other etiologies, GI motility disorders. After GI infection, because of mucositis, for a short time after healing, you can see vomit in the children. But if you wait and watch, it will be cured. Another etiology is visceral inflammation. For example, in pancreatitis, you can see vomiting as a chief complaint because of visceral inflammation, or for example, in urinary tract infection or hydronephrosis, the actually cause of vomiting is visceral inflammation. The other etiology is endocrine system. For example, in children with diabetic ketoacidosis, or for example, adrenal insufficiency, you can see vomit. And in metabolic cases, like for example, galactosemia or mitochondrial metabolic disease and others. In urinary tract, system, if your child has a kidney stone, then one of the symptoms can be vomiting. Neurological, for example, in brain tumors, and also when the intracranial pressure is raised, then we can see vomiting as a consequence. And other, etiologies, as I will tell you later, the cyclic vomiting syndrome is one of the most causes of vomiting in children. I will explain you later. And another thing that you should pay attention, especially in girls and teenagers, is pregnancy. And you should ask about the menstruation cycle. If you have any questions, you can ask me. I'm just continuing. Okay, there are some key points in diagnosis that helps you to diagnose. For example, time of vomiting. If the vomit is feeding related, for example, occurs exactly after eating or feeding, then you should be suspected about the gastrointestinal system. For example, peptic ulcer disease or malrotations and things like that. If your baby experience the vomit in early morning, then some differential diagnosis like cyclic vomiting syndrome or a rise in intracranial pressure are more common. And we can see a stereotype recurrent vomiting in syndromes like cyclic vomiting and characters. If you see that your child, has vomiting and severe dehydration, then you should think about gastrointestinal infection. Actually, vomiting itself alone won't cause severe dehydration. Okay, unless it has, for example, diarrhea, or for example, your vomiting is prolonged and very severe. So if your child is dehydrated, you should think about gastrointestinal infection. And episodic, for example, as I told you, in cyclic vomiting syndrome, the vomiting sessions are episodic, forceless. For example, I can tell you achalasia, when your esophagus is dilated, and the vomiting sessions are forceless. It can be projectile in, for example, meningitis, or increased intracranial pressure. It can be bilous. For example, if the obstruction is below the water ampulla. Water ampulla is located in the second part of the duodenum. And if the obstruction is below the water ampulla, then your vomit is bilous. Another character is mucus. If you have allergic rhinitis or sinusitis, then you may see mucus in the vomit. It can be bloody, for example, in inflammatory bowel disease like Crohn's disease or ulcerative colitis, and also in for example, peptic ulcer disease, because of the high secretion of the acids, the mucosa may be disrupted, and you can see blood in your vomit. And malodor breath also present in, for example, sinusitis, H. pylori infection, and allergic rhinitis. Okay, there are some accompanying signs and symptoms that are very important to pay attention. For example, abdominal pain. Can you tell me that if your child has abdominal pain, what would you think about? Can anyone tell me? No? Okay. I can name, for example, appendicitis, or ranga, infection, obstruction, invagination. Okay, very good. Actually, the gastrointestinal infection causes tenesmus, and you can see it as an abdominal pain in a child. Another differential diagnosis is appendicitis, and you should examine the abdomen very well, localize the point of tenderness, and be aware about the side effects. For example, if you have guarding or severe tenderness, you should be aware about, for example, perforated appendicitis or things like that. Another sign and symptoms that you can see beside vomiting is constipation. As you know, if your constipation is prolonged and severe, fecal impaction forms in your intestines, and you have some kind of obstruction, and you can see vomit in these children. Visible peristalsis. In normal situations, our intestines have peristalsis, which is the contraction and relaxation of the intestines muscles. If you have, for example, ileus, then the normal contraction of the intestines are, disrupted, and you can't see the peristalsis and the movement of the intestines. So if you examine a child and pay attention to the peristalsis, you can find many things. Another thing is masses. By examination of abdomen, you can find masses. They can, for example, be hepatosplenomegaly. Then if your child has hepatosplenomegaly, then you would be suspected to diagnosis like, for example, metabolic syndromes or things like that. And besides it, it can be a malignancy or fecal impaction. If you examine the abdomen of a child with chronic constipation, you can find the fecal impaction with observation. And another thing is vertigo. You can see vertigo in children who have migraine, or, for example, tumor masses in the brain. Diarrhea, as you know, is simple, and you can see it in gastrointestinal infections, or, for example, some forms of malabsorption, like celiac disease, and neurological signs and symptoms. For example, if you have a mass in your brain or meningitis, then you can find some neurological symptoms besides your vomit and scar. Sometimes the parents don't tell you the exact history, or what has happened to their children. So by examination, you can find out some of them. For example, if you see the scar of surgery, then you can find that, oh, in the past something happened to the child, and you can think about, for example, to the obstructions and or other complications. And in family history part, you should ask about the history of peptic disease in other members of the family or migraine. As you know, one of the most important causes of peptic ulcer disease is H. pylori infection, and H. pylori bacteria is, transmitted by food and fecus. In a family, it will be transmitted very easy from a person to another person, and you should ask about it. Another thing is migraine. As you know, if, for example, the mother of a child has migraine, then the chance of migraine in a child will be increased. So you should ask about the family history of migraine in other family members. Another thing is epidemiology. For example, you should ask about recent travels or contaminated food or water, because, for example, hepatitis A virus or other bacteria or viruses that can cause gastrointestinal infection. Okay, one of the most important diagnosis in children is cyclic vomiting syndrome. I don't know if you have seen a child with cyclic vomiting syndrome or not, but actually it is the cause of 1/3 of recurrent vomiting, and the vomiting sessions occur in early morning and stereotypic. It has a criteria, I will tell you, but I think it's not very important for you, but it's good to know about it. For example, you should have less than 2 episodes per week, more than 4 vomiting episodes per hour, and the duration of each episode should be less than 72 hours. The treatment. You can treat your children with benzodiazepines, serotonin antagonists, and Some drugs are used for prophylaxis, like propranolol, sodium valproate, and also cynarazine. Okay, another differential diagnosis is bulimia. Actually, bulimia is more common in adolescent girls with family problems or body dysmorphic problem. For example, they eat a lot of food, and after that, they think that sorry, they are fat or ugly, and they make themselves to vomit intentionally, and it causes a malnutrition, abdominal pain, GI upset, nausea, and dental erosion. The treatment is mostly psychotherapy. And here is some of psychogenic causes, for example, conversion reaction. In low society families, when a child can't talk about his or her problems, then they show their sadness or for example other things by conversion reaction, and you can see vomit as the consequence of for example being sad or being anxious. You should be aware about it, and actually the child doesn't know about it. He or she doesn't know that doing this because of that sadness or anxiety. Another reason is for gain. For example, your child doesn't want to go to, for example, school, and make something, for example, vomiting or fever, for example, as a reason for not going to the school. Another diagnosis is Munchausen by proxy syndrome. In this syndrome, another person, for example, mother or nurse, make the child to vomit intentionally. I don't know, by, for example, giving some drugs, some foods, or things like that, make a child to vomit. Okay, now I want to talk about the evaluation and laboratory tests that we usually ask for a child. One of them is a complete blood cell count, electrolytes, BUN, creatinine, urine analysis, urine culture, and stool exam. It's good to know that in some cases the only presentation of, for example, kidney problems is vomiting. So you should ask laboratory to evaluate BUN and creatinine for you. It's very important. And for recurrent cases, we ask amylase, lipase, lactate, ammonia, chromatography, liver function test, endoscopy, brain CT, or brain MRI. Can anyone tell me why we ask these labs? Can anyone open his or her microphone? I'm waiting for you. No one? I think someone is here. Hello. Okay, I will tell you myself. If you are suspected to pancreatitis, Then you ask amylase and lipase, lactate and ammoniac for metabolic disease, chromatography also, and liver function test, for example, for hepatitis, endoscopy when you are suspected to peptic ulcer disease, and brain CT or brain MRI if you are suspected to brain tumors. And drugs. As you know, vomiting is a symptom, and you shouldn't cure it until you find the exact diagnosis. So, you know, there are some contraindications for anti-emetic drugs, like gastroenteritis, gastrointestinal anomalies causing obstruction, surgical emergencies, and intracranial lesions. You know, in practice, for example, if we are suspected to gastroenteritis, we actually prescribe only one dosage of, for example, ondansetron or other anti-emetic drugs to our child, and we will follow him or her. If it continues, if the vomiting continues, then you can't give another doses. You should hospitalize your child. In GI anomalies causing obstruction, because you should see the severity of the disease and you shouldn't subside it. Surgical emergencies and intracranial lesion, because, for example, in intracranial lesions, you should see, you know, the vomiting sessions and then be suspected about, for example, tumors, and then ask brain CT or brain MRI. You know, so you shouldn't use anti-emetic drugs routinely. It's very dangerous. Okay, there are some indications for anti-emetic drugs. For example, in motion sickness, when a child or even adolescent going somewhere with car, they will find vertigo and make vomit. Then you can use anticholinergic drugs like scopolamine, antihistamines like dimenhydrinate, and also post-surgery. When the effect of you know, anesthetic drugs is gone, then your child may have vomiting. Then you can prescribe ketorolac and anti-serotonin drugs to stop the vomiting. And another indication is in children who are receiving chemotherapy. As you know, the chemotherapy drugs are, you know, stimulant for vomiting, and you can see vomit very prevalent in them. You can use antidopamines, antiserotonins, benzodiazepines, and corticosteroids. See the drugs, and I wanna show you something in the first slides. Can you see this slide or not?
Yes, we can see.
Thank you. As you can see, the serotonin receptor stimulation can trigger the chemoreceptor trigger zone, and also dopamine receptor can do the same. So if you use anti-serotonin drugs or anti-dopamine drugs, then you can stop vomiting. I wanted to show you this slide. If you have any questions, I will be glad to answer you.
In children presenting with vomiting, do we always prescribe IV fluids, like as a rule, like everyone who comes with vomiting, even without visible dehydration?
No, actually, we just prescribe or injecting IV fluids in patients who have the dehydrations. If, for example, in cyclic vomiting syndrome, your children usually vomit in the morning, and after a while, the parents won't bring the child even to the hospital. In these situations, you don't need to prescribe IV fluids, but you should examine your child very well, and if there is any signs of dehydration, you can at first give or prescribe only one dosage of anti-emetic drugs, and the choice in children is ondansetron. And after about 30 minutes, you can try eating, for example, solutions like ORS. If the vomiting session is stopped by one dosage, then it's very good, and you can continue oral, hydration. But if it don't stop by one dosage, then you should hospitalize your child and treating the hydration with IV fluid solutions. Did
Thank
you
you
get
very
your
much.
answer? You're welcome.
Yes, I understood. Thank you very much, Professor.
You're welcome. What about others? Don't you have any questions? Okay, thanks for your attention. The chat box is open, and if you have any questions and you prefer to type, you can ask me. Okay, I think you're so clever and don't have any questions. Okay, if you don't have any questions, I can finish the class. It was nice to see you. Bye bye, everybody.